Hi, my name is Nick Lin, and I'm going to talk briefly about my senior honors thesis in anthropology here at WashU, titled Fixing All These Things Requires Some Form of Currency, an Ethnographic Exploration of Homelessness and the American Healthcare System. I've worked on this project for more than a year and a half, so I'm excited to share part of it with you. So how did I get interested in this topic? Well, homelessness continues to persist as a social issue in the United States. I mean, homeless people are almost everywhere. They're present in most urban cities and rural areas as well, and St. Louis is not an exception. At the same time, in some sense, you might think of them as a little bit invisible. We see them standing on street corners and walking down the sidewalk, and just like all other human beings, we know they have full lives as well. But in some sense, they seem somewhat invisible because we don't see large portions of their day-to-day lives. So through conversations with some of the homeless and observations I made when visiting emergency rooms, I became interested in researching the intersections between homelessness and health. And as you might be aware, homeless people are some of the most vulnerable people in our society, and they're generally speaking in very poor health compared to the rest of the population. Homeless people often suffer from high rates of mental illness, substance abuse, a variety of diseases, and violence as well. So the question is, why are they so unhealthy? And is it because they're not accessing healthcare systems? How do they make decisions about accessing healthcare services? And what do you do when you have no primary care doctor, no health insurance, or no money to pay for healthcare when, as we all know, healthcare in the US is really expensive? So to understand this issue, I decided to interact directly with the homeless and focus on their perspectives. So like other anthropologists, I used both qualitative and quantitative methods. In my case, it was in-depth interviews and a survey to study this problem. And I spent the summer of 2019 in a homeless shelter in downtown St. Louis after obtaining approval from WashU's IRB. And so the question is, what did I find? Well, it became evident that the homeless in St. Louis really struggled with the economics of the American healthcare system. Things like strict eligibility requirements for insurance like Medicaid, the high cost of healthcare, and a variety of other bureaucratic struggles proved to be significant barriers for the homeless. These are systematic barriers. And maybe some of you find this unsurprising, but other economic issues related to things like transportation, employment, and the opportunity cost of accessing medical services also came into play for the homeless. Additionally, the homeless expressed a lack of sufficient social support, and I think this really negatively affected their ability to access healthcare. They didn't have many close family or friends that they could get advice from or other forms of social support, and the structure of the American healthcare system and hospitals tends to disincentivize doctors from spending large amounts of time with patients in clinical settings, including with homeless people. So the combination of those two factors, I think, led to the homeless feeling really not well heard when they're trying to get medical attention. This fact, combined with widespread feelings of stigma due to being homeless when trying to get medical care, created really negative experiences that made the homeless think a lot harder about accessing healthcare services the next time they needed help. And whether or not people I spoke to actually did receive a lower quality of care when they went to get medical attention is hard to evaluate since I wasn't present in those situations. But I do think the fact that the homeless perceived themselves as getting a lower quality of care is important because it prevents them from seeking care in the future. And since my background is in anthropology, I contextualize my findings within anthropologist and sociologist Pierre Bourdieu's theory of practice. The struggles of the homeless when interacting with the American healthcare system were amazing examples of Bourdieu's concepts of social, economic, and cultural capital. So to explain that a little bit more, economic capital we consider in more of a monetary sense, but social and cultural capital deal with other things like level of education, forms of knowledge, and social circles that people have. And these forms of capital can be just as valuable, if not more valuable, than economic capital in certain situations. So in my thesis, I explain more how the homeless lack these certain types of capital which structurally limit their ability to get medical care. I also want to point out that these circumstances may not be the case for all homeless people, but they were certainly very common among the people that I interacted with in St. Louis. So the question is, where do we go from here? I think we really need to get out of the mindset that the homeless have adequate help. I think too often we leave helping the homeless to someone else, like homeless shelters or the government, and just assume that they'll be taken care of. And I hope people come to realize that it might be the fact that we're not doing enough, or maybe we're not doing the right things. And I think my project contributed to that discussion by highlighting some of the issues that the homeless face when accessing healthcare in the United States and making decisions about their health. So more research into specific solutions to the vast number of structural constraints is needed. And I really do think that the current COVID-19 crisis in 2020 has exposed many of the problems associated with healthcare and homelessness in the United States. For example, like, how do you stay healthy when you don't have a home or access to adequate hand washing facilities or proper access to healthcare institutions in the case that you do get sick? So we really need to think more critically and compassionately about how to improve the health of the homeless. And I think looking at these problems through an anthropological lens is a great way to start. So with that being said, I hope you enjoyed this short little overview of my thesis, and thanks for listening.